Let's see here. Try to get some people invited here. Okay, so, well, good evening, Facebook friends. I appreciate everyone that is popping on to watch this. Everyone kind of knows me. I'm a pretty quiet and private person that doesn't share many details of my personal life, let alone of what the heck is up with my knee and the story behind it. So, I decided that it's time to share it, and there's a lot of big things happening within the next couple of weeks that pertains to this story, and I'm gonna need the support. So I probably will break this up over a couple of videos this evening, because it's a long story, it's a complicated story, and I'm not gonna lie, at some point I'm probably gonna start ugly crying, possibly several times ugly crying. But anyway, so, well, like I said, most people know that something's not quite right. Been walking pretty funny this year. I've got a little deal going on with my left knee and leg. So, my story starts in March 4th, 2015. It was just a nice, sunny, yet cold Montana day, and it's probably later in the afternoon, and I went out and was checking my cows and was pushing up the feed line, and I remember I just got done finishing feeding the bulls, and as I was walking down the feed line, all of a sudden my left knee gave a large crack, and I fell and hit my head. And when I woke up, I was in the worst pain I'd ever felt in my entire life. I just remember screaming and crying. I mean, it was that bad. And I'm not sure how long I laid out there, but at that point, my mom and the kids found me and hauled me into the hospital, and we found out that I had a very traumatic knee dislocation. And most people know a knee dislocation really shouldn't hurt that bad. You might be sore for a few days and then you're all right. But this was just, I had never felt pain as extreme as I had felt from that point. So what ended up happening was I was on crutches. I could not bear weight on it. It was too painful, and my knee was incredibly unstable. And so I was put in physical therapy 3 times a week. And I was doing that for the entire month of March. However, I was not getting better. If not, I was getting worse. My pain was still just as bad as it was since day one, and I was still unable to bear weight. So at that point, since we had kind of exhausted all the conservative methods you can try, the doctor decided that we were going to do what's called an MPFL reconstruction surgery. The MPFL is the ligament that I had torn in the process of my knee dislocation, and it's one of the ligaments that help hold your kneecap in place. And the thought behind it at this point is if we can stabilize the knee, maybe it won't, hurt so bad, won't cause so much pain, and obviously solve the problem of the instability. So on, April 10th, 2015, I went in to have this reconstruction surgery. The doctors beforehand came in and they said, looking at my knee, what ended up being the main nerve that ran through it was so inflamed. It was inflamed about the size of a pencil. And I mean, you couldn't touch the skin on my knee. It was that bad. And so they said, we're not sure if this is going to fix your pain or not. I had one of the most bruised MRIs they had ever seen, and for a knee dislocation in their time practicing. But at that point, there was really nothing else we could do. So we went ahead and did the surgery. And the surgery was successful in regards to my knee stability. It fixed it right up. It shouldn't dislocate anymore. But when I woke up, I was in still just as much pain, if not worse. So as the weeks went on, main goal, obviously, at this point, try to recover from the surgery. And I was just having a heck of a time. My knee was really stiff going into surgery. I didn't have full range of motion. And then after I had this surgery, it actually, it tightens things up. So you kind of have to fight to stretch that thing back out. And I just was having a horrific time to get that to happen. And so continuing physical therapy 3 times a week. And as going through this, I started having more weird symptoms kind of pop up and become more of a problem. My leg would start changing colors. It would go from bright red to like this nasty mottled bruised color, or even sometimes purple, like a purpley blue, just kind of whenever it randomly wanted to. It would change colors or change temperatures, I should say, to normally it's colder than my right. It'd just be a completely different temperature, which was just really bizarre. And I started having muscle spasms in this leg, like so severe, my leg would literally contract and kick out for hours and hours on end, and nobody knew what the heck that was and why it was doing that. And it got to the point where I was going to get referred to Mayo Clinic neurology because the spasms were just continuing and not getting any better. And it was probably about, as I was going downhill in those 2 months, it was right about, I believe it was June 2015, I started losing feeling in my left leg. My knee was still, and at the time, this pain never went away. It never got better. It was always at a 10. Just horrific. And I had not walked a step unassisted. I was on crutches. I think I got down to a cane at one point, but I was really hugging that cane. And so anyway, probably it was like week before Father's Day. I got to the point where I ended up losing all feeling and function of my left leg from my hip down, except I could still feel my knee. I just could no longer use my muscles or feel anything. It became paralyzed in a sense. And so I ended up getting flown to Denver Children's Hospital, and there they gave me the diagnosis of complex regional pain syndrome. And so anyway, at Denver, was there for a few days, and they ended up getting me sent home. There's really nothing they could do for me at that time. CRPS doesn't have any cures or really any known treatments, and the things that we did try, it didn't work. So I came back home, and the only thing I could do was get thrown back into physical therapy. And I was at that point put in a wheelchair. I was on crutches and a brace that went up and down my entire leg that would lock in place. But now I was in a wheelchair. And I was that way for a couple months, and continued to do physical therapy. I wasn't getting any better. I just kept going downhill. And it was about August at that point then too, when we ended up hearing from one of the physical therapists in my town about a program at Mayo Clinic that was a pediatric pain rehabilitation clinic. And she said she had a friend there that worked at this clinic as a physical therapist, and she really thought that I might be able, that this clinic might be able to help me. So we ended up applying for it, and I can't remember if it was September or something, we found out that I was accepted and was able to go. Well, that was all fine and dandy, and we just continued to, it was a wait list. It was like 4-month long wait list. So waited and waited and waited. And in that time frame, I mean, I just, you can't think you can get any worse, and you just kept getting worse. By October, I no longer could sit in the wheelchair because my knee lost all the range of motion I had. It completely locked up. And it was still paralyzed, so now you can't bend it. It's still in pain, and you can't use it. And so I went back to using these crutches, and I wore the brace because the brace was able to keep my leg locked so that when it dragged behind me, it looked a little more normal. But for the most part, if I didn't wear that, it would drag lifelessly behind me. So anyway, I kept getting worse, and at that point it was really hopeless feeling, getting to the point where if Mayo didn't work, I was just going to be screwed. And I got so depressed. My days consisted of, I slept until about 10 or 11 o'clock in the morning, and I just laid around, and I was so depressed because I couldn't do anything. And it was really hard too, because there was only one doctor and nurse that really believed that I was in that much pain. There were so many people that didn't understand it, and that would always say to me, so many physical therapists and doctors, oh, well, it's fixed. Oh, it shouldn't hurt that bad. Of course you can bend your knee. It's all better. It shouldn't hurt this bad. And it really killed me on the inside, because, I was a happy-go-lucky kid. I've always loved to work, and my horses and cows are my entire life, and to not have anything to be able to do with them at that point just devastated me, absolutely devastated me. And I got to the point where it came around, my birthday's in December, and I hit some really dark places, really, really dark places. The day of my birthday, I held a gun to my head. I could not stand the thought of Mayo Clinic not working, and this being the rest of my life, confined to crutches in a wheelchair and horrific pain. And I honestly don't know what stopped me that day, other than it was God's grace alone. But I didn't go through with it, and I ended up making it through that, and I was scheduled to go to Mayo in the beginning of January. And so we ended up packing up our bags, and at that point had nothing to lose, scared to death, and we flew to Rochester, Minnesota. And I went through this pain program. And that I might end up just leaving it there. I need to go pull myself together. But I'll be back on, I guess, in a few minutes and go ahead and go into what Mayo was able to do for me. So, thank you much. I'll be back in a few.